If you have been injured in another country, there are critical steps that you need to take before getting on a flight. In this video, I'll break that all down for you. My name is Bryan. I'm the Director of Medical Operations here at REVA Air Ambulance. If you want to learn more about our medical flights, check out the videos on our channel. What are the immediate steps to take after an accident abroad? Number 1, seek medical help immediately. Number 2, notify the local authorities. Number 3 would be to reach out to your country's embassy or consulate. Number 4, get in touch and communicate with your insurance provider. Can you fly after an accident abroad? Some of the risks of hopping on a plane immediately after an injury or some sort of illness when you're abroad could be things such as simple as not having the appropriate oxygen requirements on board that are necessary for you to safely get from point A to point B. The risk for further injury or further illness because you're not being treated or being cared for appropriately. There are multiple risks involved with getting inside an aircraft that may not be able to be flown at an altitude or cabin pressure that is necessary and safe for your clinical condition, such as someone who may need to be flown at a sea level cabin, as if we're going to hop on a commercial airliner, we know that that will not be the case. Also, the fear that sometimes, although we may want to immediately return back to our home country or initial place that we've embarked from, unfortunately, sometimes we need to stay in a controlled environment. And sometimes that controlled environment is staying at a hospital abroad for a day or so until you can be transported back or via an air ambulance option. Again, although everybody wants to get home as quick as possible, sometimes your medical condition just does not allow you to be cleared to be safely flown home on a commercial airline. In those situations, you have to be cleared and fit to fly from a treating physician. You have to be accepted, not just by that physician to be clear to fly, but also be given the green light by some of these airlines as well, as each airline has its own regulations, rules, procedures. Not all airlines have the appropriate seating capacity or comfort that may be needed for some of these patients. And for our patient population that are unable to travel home safely on a commercial medical escort on board a private jet or a commercial airliner, the second option would be an air ambulance critical care transport back home. In these certain circumstances, the air ambulance is a much better and much safer option for these patients that are in need because it is truly a flying intensive care unit. In addition to that flying ICU, you have a critical care flight nurse, a critical care flight paramedic, as well as a critical care flight physician should the patient's acuity need it or be justified for this. On board, we have ample oxygen for the worst case scenarios. We have ICU medications and drugs, advanced cardiac life supports. What is medical repatriation? So medical repatriation, simply put, is when someone is injured abroad away from their home and they need to be brought back home with the assistance of somebody else. Medical repatriation differs depending on the mode of transportation in which we're going to be getting a patient back home. So we have repatriation via a commercial airliner, or we also have repatriation via an air ambulance. Our repatriations on a commercial airliner, we do have two options. So it could be a simple commercial medical escort in which a clinician is flying home with that individual from wherever they are back here to the States or wherever they're going. And then there's also stretcher commercial medical escort. Not as common as a typical commercial medical escort, but there are certain airlines that do have the capability to block off certain sections of a commercial airliner and actually put a stretcher on top of a handful of seats. And this will allow a patient on a stretcher to actually be flown home with the assistance and supervision of a clinician or sometimes two clinicians. Although it is a stretcher, there are some limitations, and we have the ability to do some more complex items, but it doesn't substitute the need for a repatriation via an air ambulance. In an air ambulance situation, we're transporting patients who typically obviously cannot walk onto a commercial medical escort. These patients typically don't have the ability to sit for long periods of time. But more importantly, when we see repatriation via an air ambulance is because patients are truly injured or have a illness that is really just inappropriate to be taken home via just an escort. And these patients truly need a one-on-one, or in our cases, a two-provider to one patient transport with supervision the entire time. How can you stay prepared? So one way to stay prepared when traveling abroad is always encouraged to have some sort of travel policy, as even if you don't have to utilize it, it is peace of mind, because in the event that something does happen, you're going to wish that you had that travel policy. Additionally, while you are traveling abroad, one, you should also make sure that, you from a medical standpoint are healthy enough to go. And, if you do have medical conditions or you're on medications, you need to make sure that you're bringing enough with you, plus some in the event that there is any type of delay, as when you're abroad, it might be a little bit more difficult to obtain medications or type of special care that you have prescribed back at home. Whenever you are traveling abroad, it is always recommended to, one, travel to an area that is clear and is safe to go to. But when you're traveling and navigating around these other locations, or wherever you're traveling, make sure to be traveling as safe as possible. Safe vehicles, seat belts, things of that nature, just kind of not cutting corners in that area.